Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajlakshmi R. And she is a renowned gynecologist obstetrician from Udupi. Till 10th, she studied in Kannada medium and then she taught the University Mangalore Medical College and bagged gold medal both in gynecology as well as surgery. And later on, she did her post-graduation from prestigious Bangalore Medical College. And I'm also the student of Bangalore Medical College. Both my MD and DM I did from there. And we are proud of Bangalore Medical College, one of the oldest one. And she has been the president of IMA and she has been doing yeoman service not only in the field of her profession and also as a writer. She has made a mark in the society. And recently her book, Vatsalya the Osage, it is a comprehensive, a book which is meant for the women to maintain their health. That is the health and hygiene. And today we are very happy that she is here with us to explain during the menstrual period how a woman has to maintain her health and why it is important and what are the newer techniques. Thank you very much, Rajlakshmi. Welcome.
Thank you, ma'am. Thank you for the kind words. Yes, menstrual hygiene is a topic which was always a taboo. It was always discussed in hush hush. Nobody was talking. But nowadays, we are openly talking about it. Even we celebrate it. We have a day, 28/5, that is the May 28. It denotes 28 days of cycle and 5 days periods. So 28th of May, we celebrating it as Menstrual Hygiene Day. To create awareness how hygiene has to be maintained and what products should be used to maintain the hygiene. So first of all, we have to be clean. The ladies have to clean their genital area with fresh water and soap if needed. No need of any fancy lotions or douches, not needed. And cleaning direction also they should take care of. They should wash.
Very important.
Yes.
Because the urethral orifice and then this vagina and also the anus, from where the fecus is coming, the stools is coming, all the three are very close in women, unlike the men.
Yes,
so
close.
Any infection from the the anus can come to
Yeah. So cleaning should be they should be very careful. They should clean from the urethral side, from where they pass
that
urine
is from
downwards,
the
so that
front to backwards.
Front to back, so that they don't carry. Here I would like to add one more point. Nowadays, everybody is using jet spray. Even that jet spray can bring the bacteria forward.
Correct.
So that is also
and
they have to be
from
careful.
The backside. If they use from backside, it will come to the front. So better to use it from the front, so that that's important.
Yes, ma'am. So that also I would like to say about the. Then they can take bath. No, they have to use loose cotton cloths undergarments. That will be better for their health also. And if they don't maintain their hygiene, they are more prone to infections, which can lead to abortions, which can lead to infertility, and rarely even cancers. So what they should use to maintain their hygiene? Usually we were using pads. Previously we were using the old clothes at home. We used to tear it and make and use. But that was very cumbersome, and there was no place to dry it because we had to keep it hiding and all. So the sanitary pads came in vogue. So this sanitary pad in the beginning, it used to be only cotton pads. Only cotton used to be there. But later, as the science advanced, we started adding heavier pads, all day long pads, night pads, which absorbs more, all these things. So these pads have started creating problems to the self as well as to the environment. So because they can contain, mainly they have plastics, and they have some acids and chemicals which are used to make them stick and smell good. They are causing problems to the menstrual cycle, and even in the long run they can cause cancers. And okay, we are using pads. When we are using pads, we have to change them every 4 to 5 hours, whether they are stained or not.
Yes.
On the third, fourth day, the bleeding will be less and the staining will be less,
But
bleeding
still
will be
you have
less.
to
But
change.
still,
Yeah.
you have to change. Otherwise, they can go in for some infection because
Yeah,
blood is
and
a
that
very
is,
good medium.
yeah, extremely important point you are raising, because, in microbiology, we use the blood agar and the organisms grow very well. So here there is a blood, so the organisms will grow. Very important point you
Yeah.
have raised.
So
Thank you.
even if they are not stained, you have to change them. And before changing the pad and after changing the pad, the hand wash should be the main thing. They should wash
Very
their hands
important.
very well.
Yeah.
Very. Then
And this
after
hand wash
removing
also, they have to wash the front and the in between the
and the
finger
back,
and the tip and the thumb, and then the whole hand.
every all
Otherwise,
the 5 to 7
and they should not have the nails. And if they have the nails, and that infection also will spread. Yes.
spread. Yes. After removing the pad, how to dispose them? That is also most important. They should
Yes.
wrap it in a paper and put it in a dustbin,
Hmm.
not flush in a commode, western
Commode,
toilets,
and that will
because that
clog.
will clog the drain.
Yes.
Okay. And in beginning, we were using incinerators to burn them. But when these
Yes.
pads are burnt, they release dioxins, which are
Correct.
again carcinogenic. They can produce
Hmm.
cancer. So burning is also not good. Then we thought of digging a hole and putting them inside the ground. But one plastic pad takes around 600 to 800 years to get disintegrated.
Yes.
So it will the soil erosion will be there, soil pollution will be there, water pollution will be there. Indirectly, it will again affect the health of the human.
People.
So
Okay.
present day, the pads are going in for a different changes. We are going back
Okay.
to the cloth pads again, which have come
Hmm.
in the easier way to wear so that you can clip it on to the undergarments. Or
Hmm.
cotton pads have come, bamboo shoot fiber pads have come, banana fibers pad have come, which are eco-friendly as well as they are not causing any harm to the health.
And
They have
easy to
come.
wash and dry also.
Yes, easy to wash and dry. Uh, but some people may not be very happy with easy washing and they feel present generation, what have we have seen now, they feel it is dirty. So they don't
Use
want to
and
touch it.
throw.
So
They want to use
uh,
and throw. Okay.
use and throw. So use and throw, this cotton pads also have come. So that
Hmm.
can be used. And government is giving free of cost in the schools and colleges. It's available.
Yes.
So that
Yes.
also can be
And
made
that is
use of.
the compressed cotton pads, and especially the central government, they kept the whole women as a whole in the country, and they didn't want them to have the white discharge or the infection or the miscarriage or any problems. And that's how it is at the subsidized rate. It has been distributed to all the women all over the country. Yes.
Yes. And moving on, we have now period panties. Those are the
Hmm.
undergarments which can be worn during periods.
Hmm.
So in that also there is reusable and disposable.
Hmm.
Reusable, every 6 to 8 hours it has to be removed and
Hmm.
washed properly, dried thoroughly and then reused. Disposable can be disposed of, easier to dispose because it is biodegradable.
Yes.
Even more, we have gone into now menstrual cups, which
Hmm.
come in different sizes. All these pads, whatever I was talking, they absorb the blood. But
Hmm.
this contains the blood. It holds the blood. After it can be kept inside the vagina. If we take
Hmm.
this is the our uterus, it will
Hmm.
be folded and it will be put inside our vagina. It will be holding like this
Hmm.
blood. Once it gets filled, this can be removed out and the blood can be drained and then washed and reused again.
Hmm.
So these are the newer things which can be used. They
Hmm.
come in different sizes.
Hmm.
So based on whether she's not married,
Married or
unmarried,
not married,
married but
yeah,
not
having,
delivered,
yeah,
after normal delivery, because the size of the vagina changes accordingly, they have to change the size of this cups.
cup also. Okay.
Yes. So these
So
are all the methods which
these
can be
cups,
used.
should they be sterilized, or the, like, the water, I mean, bottles and milk bottles, should they be sterilized in the boiling water or no? And what is the material of that cup? Is it a
Okay.
plastic or
Uh,
no?
no, these are not plastic, ma'am. These are made up of medical grade silicone. They come in different sizes.
Hmm.
So this actually it can be washed with water and reused. But once after your cycle gets over, you can store it before reusing again the next month. We can sterilize with hot water. Actually, when this menstrual cups started coming to the market, it was coming with the sterilizer. Along with
Okay.
this, there was a sterilizer. We could put it
Mm.
inside that, plug on and sterilize it. But that much
Okay.
of sterilization is not needed. Even washing with clean water will
Is
suffice.
enough.
Dry
Enough.
it and keep it in a safe place and reuse in the
So
next
you get
period.
a bag to put it and then keep it.
Yes, yes. You have a nice bag for that. You can just put
Mm.
it inside, close it, and you can
Yeah.
keep it. For next time,
Okay.
again, you can reuse it.
Okay.
And only thing what I want to tell about this is, see, before starting using the menstrual cup, you usually advise after 18 years so that they know what they are doing. You better to consult a gynecologist and take their advice, because there are different methods of inserting it, how to remove
Yes.
it. That vacuum should be created. When we are removing, you have to pinch and pull it. Otherwise, it will cause little pain. That
Yeah,
vacuum what has
abrasion,
created,
and then it may
yeah,
hurt them
go,
inner portion.
because
Yeah.
it stays there because of the vacuum. That vacuum has to be broken and then pulled out. So these things
Okay.
have to be told to them, how to insert, how to remove. So if they
Mm.
take advice of gynecologist and then start using it, it's a boon. You can go
Yeah.
anywhere, you can play, you can dance, and they don't even feel
I
that they're having periods.
Periods. And one more thing,
Yes.
Dr. Raj Lakshmi, the youngsters now may feel shy to come to the doctor to consult. Are you having any program to go to the schools and colleges, the women college, and then educate them regarding this? Have you been doing this, like how we do
Yes.
the preventive? Yeah, yeah.
Yes, of course, ma'am. We have been doing that. And in a short time of period of time, even the government will be giving, as it is giving the pads now, it will also start giving the menstrual
Okay,
cups.
okay,
Yes,
okay.
menstrual cups will be this, because once you buy this, this is around now, depending on the quality, 400 to 800 rupees. And this
Hmm.
can be used for 10 years.
Okay.
Okay, and this is so price is less, so we say cash free for 10 years. 300 is meager
Nothing,
amount.
nothing.
And
Yeah,
then it is trash free. We don't have any trash to dispose. And it
yeah.
is rash free because it is inside the vagina. It
No
doesn't cause
allergy,
any
nothing, no
itch.
rashes. Yeah.
Yeah, it doesn't cause. So government is planning to provide this also now. It is
Hmm.
instead of the pads. So it started
Okay.
promoting this also. So whenever we go and talk on menstrual hygiene, we do tell the girls about all these things.
Okay.
Menstrual,
Okay.
the menstrual
So,
cups.
yeah, thank you very much telling about the cash free, trash free, and rash free. Because, all the three are taken, and then you don't feel dirty, and then there is no infection. And then the complications of infection, abortions, and white discharge, backache, and cancer all can be prevented. So, prevention is better than cure. And I think Shuchitvave Daivatva. That means the cleanliness is godliness, and especially for the women during the menstruation, and it is all the more very important. Thank you very much, Dr. Raj Lakshmi, for explaining so simply, and then it's such a beautiful way. Thank you very much.
Thank you, ma'am. Thank you for the